Well, every day should be about awareness when it comes to your body, but March is deemed Colorectal Cancer Awareness Month, and we do have information in just a moment about a doctor dialogue event for you to attend. But first, let's learn more about this disease with Dr. Ben Kieff with Spectrum Health Medical Group. Good morning.
Good morning, Leanne. Thanks.
Yes, and so we're talking about this. How do you explain to somebody where colorectal cancer occurs in your body?
Colon and rectal cancer occurs, basically it's a tumor that develops in the lower part of the digestive tract, either in the colon or in the rectum. Okay, and as we talk about awareness this month, it's very important to point out some of the symptoms that people will experience. So what will they experience? Yes, unfortunately many of the symptoms of colon and rectal cancer aren't very prevalent until the cancer is quite advanced, and that's why getting screened to try to prevent colon cancer is so important. But when colon cancer is advanced, sometimes patients can experience blood in the bowel movement, or abdominal pain, or an overall change in their bowel habits. Okay. And as far as an age group of men that should actually go and get regular screenings, how does that work? Actually, it's for men and women. Yeah. It's for people. 90% of colon cancer occurs in people over the age of 50. So it's recommended that everyone, whether they have a family history or not of someone with colon cancer or symptoms, should get screened. Sure. And we want to go ahead and show some video that we have. I had a colonoscopy when I was 24 years old. It sounds scarier than it is. I think people need to realize that, don't they? Oh, absolutely. The biggest thing that we hear afterward is, what's the big deal? It's not that big of an event. So here's a video of a polyp being removed. A lot of people wonder what a polyp looks like. Right. It's basically a mushroom-like growth in the colon. Yes. And all cancers start off as a polyp, and here a device we call a snare is being used to remove this polyp. And the patient is completely asleep at this time, and they do not feel this. You can't feel polyps growing inside your body, and you can't feel them when they're removed. So this polyp has been removed. It would then be collected and sent to a pathologist for analysis, and that would tell us when the patient needed to have another exam. And a lot of times people avoid these procedures, I think, and I think maybe you agree, because the recovery time. So talk to people at home about the recovery time for something like this. The recovery time, the procedure itself takes literally about 15 to 20 minutes. The patients receive sedation during the procedure so that they're asleep and comfortable. Sometimes the recovery time for that can be a few hours. Patients typically are discharged home, though, about a half hour to 40 minutes after the procedure, and they may go home, take a light nap or something like that, but they're able to return to usual activities the next day. Okay, and once again, we do have that doctor dialogue coming up. That's very important. We can go ahead and put that information on the screen as well for people to go ahead and come out. It is on Thursday, March 26th. It is from 7 to 8:30 at Frederick Meyer Gardens. Is it best if people pre-register for something like this? Yes, you can pre-register on the spectrumhealth.org website under events. Okay. And I'll be speaking at that, and would be glad to field any questions from the general public. It's geared for the public. Okay. So once again, go ahead and seek out help if you definitely need it, and check with the people at Spectrum Health, because you have a wonderful staff. Oh, thank you. All right, there's more information on the screen where you can find that 4100 Lake Drive Southeast, Suite 205. Give them a call at 616-267-7414. Thanks for stopping by. Well, thanks for having me. Have a great weekend. All right, coming up in the morning.